B, and this is the consideration of bids of emergency.
It's an emergency, I gotta handle that.
Emergency backup generators plus carpenter work. This is emergency backup generators at Pruitt Health Facility, Mr. Tyler.
So all the way back in 2019, the board at that time, which I think was the same except for Commissioner Smith, authorized staff to submit a hazard mitigation grant to GMA for backup generators for all 5 of the Pruitt Health facilities in Valdosta. So that's 4 nursing homes, Lake Haven, Crestwood, Holly Hill, Valdosta, and then Parkwood Development Center. So I wouldn't say fast forward, but going very fast. In January of 2025, we actually finally heard from FEMA, and those grants were approved. So working with our partners at Pruitt Health, Pruitt Health engaged an electrical engineer because there's a lot of, the generators are easy, but the electrical work to actually get the generators connected to the building, because the age of buildings is pretty significant. So electrical engineer designed everything. Then we took those specs, those drawings, and issued a request for bids. And last month, we received 5 bids, and once we opened the bids, 2 of the bids were determined to be non-compliant because they didn't meet all of the technical specifications. So of the 3 bids that were received that did meet specifications, one of the things when we did the bids, we did allow vendors to submit more than 1 bid. So to say they represented more than 1 different manufacturer of generators, they were allowed to submit both, primarily because of lead time. So Current Edge Solutions submitted two bids. Their low bid was a Winco generator, which the total for all 5 facilities was $1,420,148, with the generators taking about 12 weeks to arrive, and the transfer switch is 18 weeks. They also submitted an option for a Caterpillar generator. The total for that was $1,470,216, so roughly $50,000 more. With the lead time for the generators was 30 weeks, the transfer switch is 35, and then the final proposal was from Power Electric for a Cummins generator, and the total amount of $1,845,208. So after reviewing all of the bids, the recommendation of Pruitt Health and staff is to go with the Caterpillar option, even though it's $50,000 more. Caterpillar has a larger maintenance network, so it'd be easier to get maintenance. Things don't break on Monday through Friday, 8 to 5, which is the maintenance contract, maintenance service that Winco provides. Caterpillar, they actually, Hanson Brothers, has a dealer in Albany. The other main difference is Winco offers a 2-year warranty. Caterpillar comes with a 5-year warranty. So we felt that you get a better product, better warranty, better service by going with the Caterpillar option. With this, we actually the $1,470,216 is almost exactly what the grant award was for. 75% of the grant, 75% of the money will be reimbursed by FEMA, 10% will be reimbursed by GMA, and then the remaining 15% of the cost share, pursuant to our original agreement back in 2019 with Pruitt Health. Anything over and above the money that the county is reimbursed from GMA and FEMA, Pruitt Health provides that reimbursement. So the county is basically a fiscal agent, pass-through, but we will receive all of our funding back, regardless of which but nursing homes are eligible, so we applied over half. And then we have an agreement in place that anything over and above what the grant covers, that they'll be responsible for. And they're more than happy because they're getting generators for 10 cents on the dollar. So, and you know, from an emergency management standpoint, I'm excited to be able to do this because that's really when we have storms, that's the primary reason they call even assistance is because they don't have power. So we can eliminate, and these generators will cover the entire building. HVAC, every light, every outlet, it fully generates the entire building. So that should eliminate most of their emergency needs if we were to have a storm.
Ashley, when you speak about these 5 nursing homes, do you have a number of residents that just total? I'm assuming it's hundreds, probably not to the thousands level.
Yeah, it's not thousands. It's, I believe that Lake Haven, Parkwood, and the Valdosta nursing home is right across from the hospital. I think they each have like 105, just a little over 100. And then Crestwood and Holly Hill, I think, are a little smaller, maybe like in the 80s, but you can roughly estimate it's 500, around 500 people. This will serve, of course. That's not counting staff, but that's 500 actual residents that live in nursing homes.
It's a big win for our community for critical care and disaster response.
I had a question also, actually, just in regards to the bid itself. The type of generators, was it expressed in the bid document when it was placed out? I noticed Howard, it's local, and the other one is in Savannah. But I'm just saying the name we know means something.
So we don't, what we did is we gave, and this is really all our bids, I think Chad and Steve and Megan said the same thing. We may give them, something as a reference, but we don't specify that it's got to be a specific brand. As long as we provide the detailed specs, and as long as whatever generator they have, it meets the size requirements, the warranty, like all of the things that we say that generator has to have, it could be any brand, as long as it meets those specifications.
Actually, I agree with, the cat generator having longer warranty is critical, but the lead time's a lot longer. The other ones you could possibly have installed before hurricane season, at 156 days versus 275.
That's true, and when we looked at that, kind of the way we evaluated that is, that's really the only selling point of that Winco generator. But if you get a generator installed before hurricane season, but then something happens at 2 o'clock in the morning, you can't get it fixed, have you really gained anything?
Any other questions? Ashley,
We have a Yancey dealer here.
They do. The Yancey dealer here doesn't do generators. So, but they're affiliated. So, the side of the Yancey that does generator will come out of Albany. That's still an hour and a half. They can have somebody here. So,
Ashley, I have basically for clarification for everybody. This opportunity was offered to all nursing homes in Lowndes County, as well as our private well systems as well. It was not. The only ones that we had that has taken part and took advantage of it has been Pruitt Health. In case somebody comes back and says, why didn't I get a generator? Because they were all offering it. Everybody was. It was a great opportunity, and they just didn't take advantage of it.
Why would the others go for it?
I guess they didn't want to pay the 10%.
and some of it, so like I will say, like